Hello and welcome. Today we're talking about a very important topic that affects millions of people around the world: sexually transmitted infections, or STIs. These are infections that spread primarily through sexual contact. While the subject may feel sensitive, it is essential for everyone, regardless of age, gender, or relationship status, to understand how to protect themselves. Knowledge is power, and prevention is always better than treatment. STIs include a wide range of infections such as chlamydia, gonorrhea, syphilis, human papillomavirus (HPV), herpes, HIV, and many others. Some infections are curable with proper treatment, while others are lifelong but manageable. The biggest challenge is that many STIs do not show symptoms immediately. A person might feel perfectly fine, but still carry and transmit the infection to others. That's why regular testing and preventive measures are so important. One of the most effective ways to reduce the risk of STIs is using protection consistently and correctly. Condoms, both external, male, and internal, female, are highly effective at preventing infections like HIV, gonorrhea, and chlamydia. Dental dams can be used for oral sex to reduce exposure to viruses like herpes or HPV. Remember, protection only works if it's used every single time. Skipping protection even once can put you at risk. In addition, mutual monogamy, where both partners are only sexually active with each other and have been tested, significantly lowers the chance of infection. Another key to prevention is regular testing. Many clinics, hospitals, and community centers offer confidential and affordable STI testing. Getting tested doesn't mean you don't trust your partner. It means you care about your health and theirs. Experts recommend annual testing for sexually active individuals, more frequent testing if you have multiple partners or engage in higher risk behaviors. Early detection means early treatment, which prevents long-term complications and stops the spread to others. Did you know that some STIs can be prevented with vaccines? The HPV vaccine protects against strains that cause cervical cancer, genital warts, and other cancers. The hepatitis B vaccine is another powerful tool in preventing infection that can lead to liver damage. If you haven't been vaccinated, it's worth talking to your healthcare provider about your options. Open and honest communication with your partner is a critical part of STI prevention. Before becoming sexually active, have a conversation about past STI testing and results, condom use preferences, sexual history if comfortable. It might feel awkward at first, but these conversations show responsibility and respect. Remember, if a partner avoids talking about sexual health, that could be a red flag. Certain behaviors increase the chances of contracting an STI, such as having multiple sexual partners without protection, engaging in sex while under the influence of alcohol or drugs, which can impair judgment, sharing needles for drugs, tattoos, or piercings, which can spread infections like HIV or hepatitis. Making conscious and safe choices in these areas greatly reduces your risk. To sum up, preventing sexually transmitted infections comes down to three main pillars: protection, testing, and communication. Use condoms, get tested regularly, talk openly with your partner, and consider vaccinations when available. Your sexual health is an important part of your overall well-being. Protecting yourself isn't just about avoiding infection. It's about building trust, respect, and a healthier future for yourself and your relationships. Thank you for listening. Stay informed, stay safe, and take care of your health. One of the biggest barriers to prevention is misinformation. Let's clear up some common myths. Myth 1. I can tell if someone has an STI just by looking at them. In fact, most STIs don't show visible symptoms right away. You cannot judge by appearance. Myth 2. If I only have sex once, I won't get infected. Fact. It only takes one unprotected encounter to contract an STI. Myth 3. STIs only affect certain types of people. Fact. STIs don't discriminate. Anyone can be affected regardless of age, gender, or background. Breaking these myths is the first step toward awareness and prevention. Testing is important, but so is routine healthcare. Regular visits to your doctor or health clinic provide opportunities to discuss your sexual health openly. Get screened for infections even if you feel healthy. Receive vaccines or treatments if needed. Think of it like car maintenance. Waiting until something breaks down can cause more damage. Prevention keeps everything running smoothly. Prevention isn't just about condoms and testing. It's about lifestyle. Healthy habits reduce risk. Limiting alcohol and drug use, since impaired judgment often leads to risky choices. Choosing trustworthy partners who respect safety. Always carrying protection just in case. Preparedness and responsibility are part of self-care. Sexual health is not just physical, it's also emotional. Many people feel fear, shame, or embarrassment about STIs. But remember, asking for testing shows maturity, not mistrust. Saying no to unprotected sex shows strength, not weakness. Talking openly with your partner builds trust and respect. Taking care of your sexual health means taking care of your mental and emotional well-being too. In today's world, technology can actually help. Many health apps remind you of testing schedules. Confidential telehealth services provide advice without embarrassment. Online platforms can locate nearby clinics for testing or vaccination. Prevention has become more accessible than ever before. STI prevention is not just personal, it's a community effort. When communities support sexual health education, everyone benefits. Schools, clinics, and awareness campaigns play an important role. If we break the stigma, more people will get tested. Talk openly and prevent the spread. To wrap up part 2, prevention is about more than just science. It's about breaking myths, forming healthy habits, caring for emotional well-being, using technology, and supporting awareness. Your choices not only protect you, but also protect the people you care about. Remember, safe, informed, and responsible decisions build a healthier future for everyone. Thank you for staying with us in this second part. Stay safe, stay aware, and always value your health.